Surgery for the knee, surgery for the shoulder, surgery for any joint really is very invasive and traumatic. One of the big questions that patients have is, how do these treatments differ from more conservative approaches and more traditional approaches that we would take for addressing knee pain and other joint issues? Well, number one, let's start with surgery. Surgery for the knee, surgery for the shoulder, surgery for any joint really is very invasive and traumatic. Now, I know there are different techniques where surgeons, use more of an arthroscopic, camera-guided type approach to the procedure, which is more minimally invasive than a larger open procedure, but there's still trauma that comes with that. They're still cutting through tissue. They're still maybe altering or cutting out tissue in terms of like a surgical clean out. So there are alterations that are made to the joint that may be permanent and may not actually solve the problem that you're looking to solve. These treatments that we're talking about today are much more minimally invasive. We're only using needles as opposed to using open incisions and scalpels. And I'm placing these cells that we've talked about in very precise areas and very directly in areas. And we're using guidance to avoid nerves, to avoid blood vessels, and to make sure that we get these treatments directly to where they need to be so that the outcome is the best. Also, because of that, the rehab process after these procedures is much less involved. People after these procedures are usually going through maybe a couple weeks of rehabilitation, where after surgeries, that rehabilitation may take months or even years to accomplish to make sure that we're achieving the same goals. So your rehab time is cut by about a third. So when we're talking about surgery versus these minimally invasive techniques, there's so much less risk in terms of outcomes with other adverse things that people don't want to experience, things like nerve damage, other medical issues like stroke, or even death is one thing that people will have to be very concerned about. After surgeries, those types of risks or those morbidity risks are increased by about 300%. Whereas after these types of minimally invasive procedures, the biggest problem that patients have suffered is usually just discomfort at the injection site. So you're significantly reducing risk for adverse outcomes and adverse events after these types of procedures. So when we're talking about doing these procedures versus surgeries, there's definitely advantages to this, and people are getting excellent outcomes and excellent improvements in their functions. If you subscribe to this page, like this video, comment in the comment section below. We can reach out and answer any questions that you may have. But also, we're gonna go through some more videos that are gonna help you learn a little bit more about these procedures, and we're gonna give you some additional information to help to continue you on your journey to getting better. What you can do today is give our office a call. Our number is 412-963-6480. You can talk to our regenerative representative. She'll get you set up on the schedule to be able to come in and actually see us for an official consultation. And we can talk more about what you're experiencing, whether it's shoulder pain, knee pain, hip, back. We treat it all. So don't feel like you wouldn't be a candidate for these procedures or that there's not something that we can do to help you. Come in and get your questions answered and come in and see us so that we can definitively let you know what we feel like we can do for you.